All right, welcome everyone. The TPS and School Collaborative presents How to Identify Anxiety in Your Children and Teens. This is February 9th, 2021. Just a reminder, this session is being recorded. Alina Rodriguez could not make it this evening, or this afternoon. So it's just me. My name's Nicole Shetterly. I'm the Family Engagement Coordinator for the Early Childhood Program. And if you'd like, you can introduce yourself in the chat. And we have a special guest, Emily Roemhild, and she is a psychology intern at Zepf Center. So she's going to present the information tonight.
Cool. All right. Let's find. Okay, so when I press present now, it only shows like a couple of my screens, but PowerPoint's not one of them. Do you know if there's...
You can try the window or the tab or your entire screen.
Okay.
One of them.
I guess I can try my entire
That should work.
screen. And then just...
There you go.
Oh, did that work?
It's working. We can see your screen. Yep, there you go. You've got it.
Okay, perfect. So you can see the PowerPoint?
Yes.
Wonderful. Okay, perfect. And then should I leave minutes for questions at the end or take up till 4 o'clock, or what's kind of the routine?
Yeah, you can, if somebody has a question, you can either put it in the chat or they can unmute themselves. So you can unmute and ask the question during the presentation.
Okay, perfect. Because I can only see my slides right now, so I can't see any of you.
Yep.
And that's totally fine. Okay, sounds good.
All right.
So thank you for the nice introduction. So as Nicole said, I am Emily. I am a doctoral student at the University of Toledo, and I'm interning at the Zepf Center right now. And actually a lot of my research and clinical work is in anxiety with children and teens. And so today I'll be spending some time talking to you about why we have anxiety, what it is, what it looks like, and what we can do about it. And I have a lot of visuals through here just because I think it's a little more fun and easy to understand with some visuals. So hopefully we'll have some fun. Alrighty. So to begin, I like to kind of explain, the spectrum that we put child behavioral and emotional disorders or symptoms on. And by a spectrum or continuum, I mean, you can fall anywhere along this. So you might be all the way to one side, but it's not mutually exclusive, which means you might not be all of one and none of the other. So we typically categorize behaviors from internalizing disorders to externalizing disorders, and then based on kind of how controlled those symptoms might be. So on the externalizing side, we typically think of those behaviors as they're under controlled, or the child is unable to kind of inhibit their behavior. And so a lot of people might be able to recognize these behaviors. So this might look like aggression, irritability, delinquency, a lot of acting out, because there's really no regulation or coping mechanisms in place. So really we kind of recognize those behaviors. On the other side are the internalizing symptoms, or what we would call over-controlled. And so these kids are a little bit harder to recognize because everything's happening internally. And so we might not notice, we might not pick up on these symptoms or these behaviors. And so these manifest as a lot of anxiety, worry, tension. And this is kind of the camp or the side that we're going to be talking about a little bit today. Because as you can imagine, anxiety is more happening on the inside, even though we might have some delinquency, aggression, acting out. So again, it's kind of a fluid continuum, but we're going to be talking about internalizing anxiety today. So when we think of anxiety and like, what is it? I think the easiest way to kind of explain are the 3 parts. So we have our cognitions, which an easier way or an easier word to think of is our thoughts. So what is going on in our mind? These are the things that our brain is telling us. These are the worries that we can identify. These are the things that we realize that we're anxious about or we're struggling with. But we also have these physiological sensations, and that's even a bigger word. And so I like to think about that as our feelings. So what's going on inside of our body. How is this affecting us physiologically? But what do we feel? How are we feeling? And that's an easier way to kind of think about that. But the important part is that all of these influence each other. So then our thoughts are then going to influence our feelings, which are then going to influence our behaviors, or another word, our actions. So I like to think of these a little bit as a web or a cycle, which I'll explain a little bit later. But like I said, they all interact together. So our thoughts are going to influence our feelings are going to influence our behavior. And a lot of anxiety is this pattern, kind of over and over, and we'll break it down per domain here shortly. So anxiety, it's important to kind of understand why we have it. And I'm sure all of you, either with teens or children or yourselves, like you've been anxious before, right? Like we're not going to say that I wasn't anxious before this presentation. We can't say that we've never been anxious, before a test or before a presentation or before an interview. So everybody has anxiety. And it's easy to think about it as like our alarm system. So it's our body's way of keeping us safe and away from danger. And humans have always kind of had this anxiety. Otherwise, we would be running into the streets, getting hit by cars. It kind of keeps us safe. So an analogy I kind of like to use is a bear. So when you see a bear, if we didn't have any anxiety, we might just walk towards the bear, not worry about it. But that system in our body that kind of gets alerted when we sense some sign of danger is going to make us stop and think, okay, what do I need to do? How do I respond to this? And ultimately probably run away. So again, if we didn't have anxiety, this whole process really wouldn't happen, and we would probably end up in some sort of danger. So this is why we have it. It protects us, it keeps us safe and out of danger. And so when we think of anxiety in the way that our thoughts, emotions, and actions kind of regulate or keep us going, there's usually three kind of responses that we respond to anxiety with. So the first one is fight it. Well, so we can decide that we're really tight or tough in front of a bear, and we might end up fighting the bear, thinking that we're competent, just as tough as a bear, and you might stay there and fight it. Some people might flee or flight, which is run away from the danger, avoid the danger, do anything they can to get away. Other people might freeze. And so you might see kind of any of this happening, but usually these are the 3 Fs, we call it, or the 3 responses when we see danger. And, one thing to point out too is that one kid, teen, or adult, or you, whoever, might not respond the same way in every single anxiety-provoking situation. So sometimes we might fight, sometimes we might freeze. So there's really no one pattern per se, or one mechanism that a kid or a teen might choose. But they might use all of these in different situations. But these are the relatively common ways that you'll see individuals kind of experience anxiety. So as I've kind of alluded, like we all have it, it's really helpful, but there are times that it can also be pretty harmful. And this is when we start to see it become distressing for a kid or a teen, or it's starting to interfere with their life. And so a lot of it might come down to like, I'm really not happy, a lot of avoidance, which we'll talk about later. But it's starting to prevent them from engaging in their life and doing the things that they need to do or they like to do, because it's kind of this paralyzing sense of fear, something's wrong. And by false alarms, I kind of mean that if we think about our body as the alarm system, and we're going to kind of overreact to situations, even when there might not be any danger. And so, for example, me, before the presentation, like, yes, okay, you can get a little anxious, you're having a presentation, but there's really no danger. A child, perfect student, gets all A's, panics during a test. There's really no sense of danger. They've always done well. They've always gotten A's. They've gotten good grades. There's really no reason to have that kind of reaction. But as we have more of these false alarms, we're then learning that, okay, like I get really worked up, it happens, I have this anxiety response, but it was a false alarm. And so that's just going to keep reproducing and it's going to keep happening. And then the kid eventually is going to kind of develop this anxiety response even when it's not needed. So a way that we like to think about it is kind of this anxiety cycle. And what does this look like and why it's really important to intervene and really help these kids and teens. So this little visual can be really helpful. So we can think of any situation that we might have and we might experience some kind of worry or panic, right? So we have some kind of response, we're worked up, we're anxious. That's going to cause us to probably avoid the situation. So if we say, what's an easy one? Like a spider, right? If we're afraid of spiders, we're going to see a spider, we're going to panic about it, we're going to become very uncomfortable, we're going to avoid that spider, we're going to run away. Say it's in the bathroom, okay. We'll avoid going to the bathroom, inside the bathroom, there's a spider in there. Okay, well then we might feel a little bit better because honestly, we didn't have to deal with the spider, we don't have to deal with the bathroom, we're away, we're safe, there's no danger. I feel pretty good, I don't have to deal with it. But then what's going to happen is there's going to be this resurgence of this worry or panic. And by that, I mean, because we ran away and we didn't use any of our coping skills or our abilities to handle the situation or get the support that we needed, and instead ran away, we're going to get this resurgence because we really don't know how to deal with that situation. It's going to happen again, but we are not learning the ways to deal with the situation. Also, we get this temporary relief, but we might think about it. We might walk by the bathroom all the time and be scared. So it's not really going to take care of the anxiety that we have in our body. And so this resurgence also is going to lead to a feeling of loss of confidence in our coping abilities, whether we don't have any, whether they didn't work and we tried it, whether we couldn't think of any. And then this often leads to more worry and panic for future situations down the road. Because if kids and teens realize that what they've tried or didn't try or don't have in terms of coping abilities don't work, that's going to increase that worry and panic down the line. And it's going to make it really tough to kind of cope with these things. And so that keeps you stuck in this cycle. And you can imagine if they're not practicing or getting help or getting support, that worry is going to be maintained. It's not going to reduce. And then we're going to just keep going in this cycle. And the thing that's important to note is that even though this might have started with a spider, does not mean it's just going to stay with every course of a spider. This eventually, like with the too many false alarms that I mentioned, is going to generalize because this is just the body's response that the kid and the teen are learning. And so if our body is just conditioned, I guess is a pretty good word, and used to that kind of response, then it's not just going to go from, that's how I treat a spider, but that could transition to school, that could transition to sports, separation from parents. I'm trying to think of the domains of anxiety that we'll cover. But this is just going to be our body's response. And so that's really hard and it's really tiring. But that's the nature of anxiety. It's a nice, nasty, if you will, cycle. All right. So as I've kind of been alluding to, there are several different domains of anxiety. So when I say anxiety, that's a very broad term, but we can see anxiety across very different domains. And so we might see anxiety in social situations. We might see anxiety that's a little more generalized. We might see panic, separation, specific phobia. And so what I'm going to go ahead and do, because some of these words might be new, we might not know what these all look like. I'm going to walk through each domain and kind of give you a little overview of what those thoughts, feelings, and actions are going to look like, because that might be really helpful in terms of what does anxiety in children and teens look like and how do we identify it. Because I feel like a lot of times you just throw around the word, I'm so anxious, I'm so worried, but really, what does that mean? And we have to identify it in order to help. So I'm going to go ahead and begin with social anxiety. And so first, kind of like it sounds, our thoughts are going to be related to fears of being the focus of attention and embarrassing oneself, fear that I'm going to be judged. A lot of times it'll manifest, you'll hear kids say, oh, I don't want to say something wrong. I'm going to trip over my words. I'm going to use the wrong word. You'll hear kids say, like, I don't want to forget what I'm saying. I don't want people to laugh at me. So this is all kind of that fear of negative evaluation, that fear of judgment, and like what other people are thinking about us. So those thoughts often manifest as an increased heart rate, physical kind of shaking or trembling. You might see kids or teens start to sweat or become, red and blushed, while also some hyperventilation, and that's a pretty big word too, but really just means shortness of breath, where like we feel kind of like we're suffocating. We breathe rather quickly because we're breathing more shallowly, and so we're trying to get air, but we're experiencing difficulty doing so. And there might be some dizziness there too. And so again, these are the inside kind of responses that we might not see, or the internalizing component. And so kind of this fear of negative evaluation, judgment from others, what are people thinking about me, can also lead to avoidance of the feared social situation. So this might look like, I don't want to go to school. I don't want to go to that class. I don't want to go to that sleepover, that birthday party, that play date. Because again, as I mentioned with that cycle, it's that avoidance piece, right? How can I get out of this? How can I get temporary relief and not do this? Because that's what's going to make me feel better, which is completely normal. When we all think about it, we don't want to feel that way. Neither do kids and teens. So it's how can I get out of it? So you'll see this as a lot of avoidance and a lot of refusal. And that avoidance is a word that I'm going to be using quite a bit, as you'll see kind of through anxiety, which really highlights the behavioral aspect. So generalized was the second domain that I had mentioned. And these thoughts are a lot more broad. And so like it's general, kind of as the word says. So this is excessive worry about future events, past actions, their competence. And the really important part about generalized anxiety is that it covers multiple domains. So this could be, related to sports. This could be related to their performance in school. This could be related to family life, their own health. So it's going to be kind of this excessive worry among many aspects of their life that you see this kind of happen. So this is going to bring kind of somatic complaints. And by that, I mean physical kind of tension, stomach aches, headaches. I think a lot of kids will say, my head hurts or my stomach hurts. And we might say, oh, you're coming down with something, but really it could just be this anxiety in their head that's related to that physical sensation or somatic complaint. And so what this is going to look like is this is going to be a lot of perfectionism. So I have to be perfect. I have to do this just right. I can't make any mistakes. I have to get a lot of A's. It's going to look like over preparation for tests and projects. So if you have a teen that's studying all the way, till midnight and not feeling like they're quite ready to ace that test, you're going to see, times that they could have stopped studying way earlier, but kept going just because they want to ensure that they know the information. You might see some excessive slowness because they're stuck up here, right? Their thoughts are just running and running. The way I like to describe it to parents too is like it's kind of a snowball. We're building a snowball. So you start with one thought and then that goes to the next one, that goes to the next one, that goes to the next one. A good example would be for a teen, oh, I'm not going to do well on the test, which then might go to mom's going to be really upset with me, which then might go to what if I don't get an A in the class? What if I don't go into college? And you can see how in a little kid or teen that this is just going to grow to be a big snowball. And so I think about that if that's helpful. So you might also see some reassurance seeking, and this is a lot of checking. So am I going to do this right? Am I okay? How well did I do? Did I get that right? So looking for that approval from other people to kind of calm them down. Some tears, probably, because it's frustrating, it's exhausting. Again, that avoidance piece. And we might get some of that irritability, arguing, resistance, because they're just so overwhelmed by carrying, all of this and all those thoughts just running through their head. And they don't feel well, with stomach aches and headaches and that kind of a thing. All right, so this next one is separation anxiety. Kind of like the word implies, this is separation from a parent or a guardian. And it's a lot of fear that something's going to happen either to the kid or to the parent or guardian after, like following separation, or fear that they're not going to return, that the parent or guardian's not going to remember to come pick them up. Now, before I move to feelings or actions, one thing to really highlight is that this has nothing to do with the parent or guardian's consistency. So sometimes separation anxiety develops even with the most consistent parents. Like even if you're picking up your kid at 6:30 p.m., on the dot every night, just as you said, it can still develop because in that little kid's head, they're thinking, well, what if this is the one time that they forget about me? And so a lot of parents will say, I'm trying everything, or like, I don't mean to be inconsistent, but sometimes I'm running a little bit late, but it can really affect any family out there. It's just kind of this anxiety or something's going to happen. Maybe this is the one time. So I just like to point that out there too. So this is also going to manifest as a lot of stomach aches, headaches, muscular tension, and a lot of avoidant, again, that word, and distress. So clinging to the parent or guardian's leg, holding their arm, crying, obviously. Shadowing, that's probably a new word, but basically the kid's going to be your shadow. So they'll be following you, watching every move that you make, walking you to the door, doing everything they can to prevent you from leaving. So you'll see the tantrums, you'll see the crying, going to the school office and say, I'm ready to go home. I've lasted long enough in this place. And chronic absence is probably really common too. We see that because they're just too fearful. They'd rather be with their parent. They'd rather be with their guardian because there's some sense of control there. That this is something I can control. If I'm with them, I know exactly what's happening to them. I don't have to worry about it, but I see everything. And so that's why you might see some of that chronic absence from school. So panic disorder, we might have heard about this one. This one is kind of out there, maybe a little bit more. But this is the idea that our physical symptoms of anxiety are harmful. I don't like the word bad because that has a connotation that they're wrong to have, but that they're harmful, that they're doing something, harmful to our body, really is the best way to put it. So we might feel that our heart is beating really, really fast and it might hurt. We might get some chest pains. Am I having a heart attack, right? Or we're having trouble breathing. We're getting that shortness of breath, that feeling that our throat is closing. Am I suffocating? Like, what is wrong with me? And this can be really, really scary. And so a lot of people then avoid, where these are going or where they're going that causes these things. And you'll get a lot of physical symptoms. So you'll see the shaking, you might see the dizziness, the heart rate, the sweating, that kind of a thing. And so the kids might avoid school if they've happened at school. They might avoid stores, movie theaters. The mall is a pretty common one just because that's so overwhelming. But another key point here is that they appear to come out of nowhere. And I think that is what is the hallmark of, it is the hallmark of the disorder. But I think that's what really makes it scary, is that there's really no way to prepare for it. There's no way to really know when one's coming on. And so you'll see a lot of kids and teens develop what we call safety behaviors or signals, basically. And so they might take their medication with them. They might take a stuffed animal. They might take a toy, something that will be with them and then keeps them calmer and prevents, so they believe, the panic attack or the panic episode. But as I mentioned earlier with the false alarms, what's going to happen is we see that with these safety behaviors that they might not have a panic attack, and that's okay, but they might attribute that to having that toy, that bear, that snack, that medication. And so then it's really hard to separate from that and know that there might be other reasons why you didn't have a panic attack. And so that might just be something to be aware of if you notice that your child or teen might be taking something. A water bottle is a common one, something with them, right, everywhere that they go if they're rather anxious in this case. Because some kids might just like taking a toy, right? I took a bear or a blanket or whatever, wherever you go. So it definitely could be very different, but it would have to be kind of in this case to reduce some of that negative distress. So specific phobia is another one. This one is kind of related to the spider that I had mentioned. So this is a specific fear over harm from a certain object or a situation. So this could be spiders, this could be doctors, needles, blood, the dark, storms, kind of anything. Someone can be afraid of absolutely anything. And so this is going to manifest a lot like panic, really. So that increased heart rate, that shaking, that sweating, and obviously those attempts to avoid that fear object. We don't want to look at that. We don't want that bug coming at us. We don't want to be here. So anything we can do to be safe. This is a really common one. So you might see this in your own lives. So in terms of like, how can we help? So we just went through, what is anxiety? Why do we have it? What does it look like? Well, okay, now what do we do? I feel like that's a really good question and one that like we obviously have to talk about. So my research really lies in parental behaviors related to anxiety, and family accommodation is something that we don't want to do. It's really, really hard not to do it because they're basically, if you see your kid distressed or upset or anxious, you want to do everything you can to alleviate that distress, right? So this might look like, making special meals for the child, letting them avoid school, letting them avoid sleepovers, letting them sleep in bed with you. But what happens is this actually prevents the kid or the teenager from developing their own coping mechanisms, which we had talked about in that cycle, right? And it actually reinforces that what they're trying to avoid is something that we need to be fearful of. And that's really hard because we don't want to necessarily reinforce that because sometimes there isn't anything to be afraid of. And if we're letting them get out of it, we're kind of showing them like, this is something that we need to be hesitant about. But we really want to be helping them develop the coping skills and work with them to develop their independence and their confidence in handling and navigating their own world, especially as they get into teenage or adolescence. So this also leads to decreased insight, where the kid might not know, at what point do I need to use my coping skills? At what point am I okay? At what point do I need to get my caregiver? And this really the kid has to really rely on the caregiver to cope. But what happens when the caregiver is not there? What happens when, you can't rely on somebody else? And we want to make sure that the kid has the skills. I think another part of this accommodation piece is that it interferes with the parents. So if you can imagine your kid is at school and the kid goes to the office and says, I want to go home, I'm really not feeling good. And it's because of anxiety, not an actual illness. Then what happens is, the parent has to call off work or they have to, leave home. They might be caring for other children. Anyway, they have to pick up their routine and go pick up the kid from school. And so you'll find that a lot of parents become pretty distressed or report a significant degree of impairment in their own social, work life, their own kind of routine and schedule by accommodating their child. And so, but we also know that when parents are a little more anxious or tired or frustrated, that too can really influence the parent-child relationship and the development of anxiety. So it's kind of like, oh my gosh, right? This is really hard. Like, what am I not supposed to do? What do I do? But we really want to try to help the child cope, help in the situations that they need to learn to navigate, without kind of reinforcing this over-reliance and this sense that the world is so uncontrollable that you can't handle it on your own. So I kind of talked about what not to do. So let's talk a little bit about what can we do. So there's a difference between anxiety, right? So there's subclinical anxiety and then there's clinical anxiety. So subclinical anxiety would be, this is bothersome, this is frustrating, but, I can handle it. I'm still doing the things that I need to do. It's not getting too much in the way of going to school, of getting my work done, of making friends, and that kind of a thing. So in those cases, the best thing to do is normalize it, right? You could use the bear metaphor. You can use anything that you want. But basically, we all have it. It helps us. But sometimes it can be annoying, right? Sometimes it can be frustrating and detrimental. But we all have it. So this is something we all go through. And so that can be really helpful because sometimes kids and teens think they're all alone in this world and with these feelings. But if we kind of get on their level and say, it happens to all of us, it's helpful, that can usually help. We also want to approach the problem. I think a lot of times it's something that a lot of people don't want to talk about, don't know how to talk about, don't know how to explain or try to relate to. But that almost makes it a little more scary, a little more like that sense of uncontrollability, like I can't do anything about it, that uncertainty. And so, but if we approach it, that'll really help get the conversation going and help us figure out what we can do. I mentioned coping mechanisms several times. We'll talk about some here in a little bit about treatment, but really working on developing those skills, like what works for you, what works for your kid, obviously what works as a teen, those are going to be very different. So something that works for a 5-year-old could be very different than something that works for a 12-year-old. But really you're looking for anything healthy, right, and appropriate that's going to reduce that distress. And the important thing about coping mechanisms is practicing it too. I always like to say, if I was a basketball player and I learned this super cool new trick, I'm not just going to save it for game time. So I'm going to practice it in my backyard. I'm going to practice it on my off days, at practice, in the game, because these things don't just work when we want them to work. So if we're not practicing them, of course. And so what we don't want is for kids and teens to be using kind of the coping skills that we're working on as an escape. So for example, like I'm in the midst of a panic attack or I'm in the midst of, a tantrum or a meltdown. Oh, let me think about, the coping skills that I have. It might work, but the best case scenario would be to be practicing them on a normal basis, not in the midst of a really heightened episode, because that'll help you think about it quicker. That'll help your body already be a little less aroused and allow for, better coping, obviously, or quicker anxiety episode. So practice is key. And practicing as a whole family, you can make it a game, you can make it, we'll talk about mindfulness in a little bit, but how can we make it something that we all do together because everyone can benefit? Like I said, we all have it. So we also want to encourage participation. So, again, how can we make this a team approach? Let's do this together. Let's, visit the school, before we go. Let's go to the friend's house together and I'll, introduce you, whatever it is, but participation together. So there's not a sense of, you're kind of on your own. And that kind of leads into scaffolding. And so when we're building a building, we don't just build it, right? We scaffold it. We got to, build it from the ground up and protect it as it goes and support it. kind of the same way. So developmentally, we have to think about the level of support that we're giving to our kids and teenagers. So the level of support that a 3-year-old is, again, going to be very different than the level of support that a 15-year-old needs. And we want to be cognizant of that and try to be developmentally appropriately supporting the kids and what they can do and should be able to do. And so that brings us to, well, what happens when it's really at that level where we've got the significant avoidance, we're stuck in that cycle, we want to seek treatment, like what can we do? And so there's therapy, where you can have weekly sessions with a therapist and work on these skills with somebody else, which sometimes can be a really great way of, will they listen better to somebody else? Will they practice better from somebody else? Build a bond or a relationship with somebody else? And therapy can be a really useful tool for therapy or for anxiety. And then we have assessment. And so for assessment, that's looking at, a bunch of different things, but sometimes that helps get at what is really causing the anxiety, what's at the base of all of this, what do we really need to target? And that can give a direction for therapy. Because sometimes we just don't know. We know we have all these feelings and these thoughts and we're doing these things, but that question of why, we don't know. So sometimes assessment can really help pinpoint that when we're feeling a little bit lost and overwhelmed. So say that we're ready to come to treatment. We would like to see a therapist or whoever. One of the evidence-based treatments for mindfulness, and by evidence-based treatment, or for anxiety, but for evidence-based treatment, what I mean by that is that it's gone through research, it's gone through tests, and it's validated to work. And research has shown the efficacy of, or the ability of it to work, basically. So one of the evidence-based treatments for anxiety is mindfulness. And that's a lot of bringing you to the present moment. Instead of getting caught in that snowball building, how can we bring us back, ground us, center us, and keep us here instead of getting lost in our thoughts? So there's tons of mindfulness examples, activities, things like that, and that's a really useful tool. Another one, well, I'll skip down to grounding because it goes with mindfulness. I should have put them in order, but it's fine. So grounding, much like mindfulness, is like present moment, but grounding is really nice in terms of getting you connected with your senses. So I really like what's called a 5-4-3-2-1 exercise, but basically it's based on the 5 senses. And so when you're, practicing and be like, okay, what are 5 things that you see around you? Okay, what's 4 things that you can touch or feel on your body? And that could be, my legs on the floor, as an example. 3 would be, what kinds of things can you hear? 2 would be smell, 1 would be taste, and that kind of a thing. So it's just really getting you in touch with your senses. And it's really hard to be thinking about a lot of things that you're worrying about when you're trying to pay attention to kind of what your senses are taking in. So that's a really cool activity. Progressive muscle relaxation is another really good one. So we know that our mind and body are connected. So there's pros and cons to that, I suppose. But when our mind is going wild and we've got a lot of thoughts going on up there, our body's going to feel that too. And I think you would realize that kind of with my thoughts, feelings, and actions. And so what progressive muscle relaxation does is really, if we can relax our body, it'll probably relax our mind. And so the idea of that is working with different muscle groups and tensing them and releasing them and feeling the difference of tension versus relaxation. And again, like if we can calm the tension down, we're going to kind of calm our mind down. So that's a really good one for a lot of anxiety and trauma in kids and adolescents. I've had good success with that. Yoga is another one, and yoga is really fun for families. If you have YouTube, you can, just pull up yoga for children and watch videos together. It's really nice stretching and can be a really fun family activity to increase engagement too. So these last 2 are further evidence-based treatments, and the idea of cognitive behavioral therapy is basically that cycle that I talked about, and how our thoughts, feelings, and behaviors or actions are all connected. And so that therapy really looks at, okay, so if we intervene with our feelings, how is that going to change our actions? Okay. If we interfere with our thoughts, how is that going to change our feelings, which in turn are going to change our actions? And so basically, that's really looking at, can we change our relationship to our thoughts, or can we change our relationship to our feelings to then in turn have a different outcome? And so that's a really helpful therapy in terms of kind of changing the way that we're thinking about things and feeling and then responding. And the other one, so acceptance and commitment therapy, is similar, but it's more of, I recognize that I'm anxious, and that's okay, and I'm going to let myself be anxious, and I'm going to handle this distress. How do I let it be there without it jerking me around, right? So how do I let it be there without it controlling me? How do I let it be there but still able to do the things that I want to do? So it really highlights that acceptance component. So I also kind of wanted to talk about exposure therapy here for a little bit, because this is a common way that we treat anxiety, but the important part here is that it is done with a professional, so with a therapist. We don't want parents and children trying to do this together, because it can exacerbate or increase the level of anxiety that the child has. Because the idea is that it's done very structured, it's done very controlled in a safe manner. And so it's basically working on approaching, like I said, we want to approach the problem. It's geared towards approaching what we're afraid of, which does not sound fun, like at all. Not for us, not for kids, not for teens, no one. So, but that's the idea, because we don't want these false alarms. We don't want to be, concerned about these things all of the time when there's really no reason to be. And so the idea is that we challenge ourselves to face the fears. Again, I cannot stress it enough, in a safe, controlled environment. And it's kind of scaffolded, which I'll get to. But the idea is that we then learn that the things that we are so afraid of, really aren't that bad in the end. Or I use that word bad, so you got to catch yourself, but aren't that harmful in the end, and that we're okay and we can work through it, and we know how to do that. And so, it proves that sometimes we're over exaggerating, sometimes we're worried for nothing. Again, that approach instead of avoid piece, and to reduce the number of false positives. So there we go. So a common way of doing this is, if we're fearful of the elevator, what we'll do is, with a therapist or a professional, the child will work with them to develop what we call is a hierarchy. And that the child and therapist will sit together and rank, what is the easiest thing to do in terms of an elevator, all the way up to what is the scariest thing to do related to an elevator. And so the first one down to, you might go 1 to 10 or whatever. So 1 might be, looking at pictures of an elevator online. That might not be so scary. I can look at a picture. To some, it might be, a 5, but this is just an example. And, the scariest thing to do in an elevator would be to ride it 1 floor or whatever, all by myself. And so basically you fill in this hierarchy together, and you slowly start to work and build up. And so you go step by step, and taking as, time as you need, and really working on kind of approaching the fears and navigating that a little bit easier and a little bit better. And then eventually you'll say, I can do it. There's really not as much to be worried about. And then slowly that's going to start to trick the system back, right? So to kind of reduce those number of false positives, and be a little more comfortable navigating the things in their life. And this also comes with, having enough coping mechanisms to use, or coping skills to use in times of stress, because it's obviously not easy. And so we practice, obviously, those before. So we know that if we are getting overwhelmed, we've got these skills, like they're here. So so that's a little bit about kind of the treatment that we have, that your kid might experience, or things that we can do to help. I do know, yes, I'm at the Zepf Center, so that's always a resource. I also go to the University of Toledo, and we've got a psychology clinic there if anybody is looking for a resource as well. And yeah, I think that is what I have. I guess I went a little bit quicker than anticipated, but happy to answer any questions or any clarification that's needed, or comments or whatever.
Does anybody have any questions? You can just unmute yourself. All right. Well, if not, you can always reach out to Emily or myself. I can connect you to. And I appreciate you guys coming, the Zepf Center.
Yeah.
And Emily, thank you very much for the presentation. It was wonderful.
Thank you. I appreciate the opportunity.
All right. Well, everybody have a great day. Thank you.
Thank you.
Thank you. Nice job, Emily.
Thank you.
Thanks, everybody.
Thank you.